is Dr. Fatima Qureshi, and today we're going to talk about color blindness and color vision problems. This is my patient. You can introduce yourself.
Hello, I'm Mason. I'm a senior at Como High School, and I'm colorblind.
How did you know about that? It's an important thing because he came to me the other day, which was last week, right? And randomly he said, you know what, doc, I think I have color vision problems. And I said, oh wow, because in men, usually it's a red-green color vision deficiency. And he was kind of already, aware of that fact that it's an X-linked recessive disorder. There's different types of color vision problems. There's red-green, and then there's blue and yellow. The one that he has is a red-green color vision deficiency, which means that he cannot differentiate well between blues and greens. And that day, remember, we had that whole discussion about
Yes.
that. So normally people are born with that, so it's genetics, and your mom is the carrier, and mom's dad, so your grandfather, he had color vision problems. So men are going to be the ones who will have the defect, and women will be the ones who will carry the gene. Okay, makes sense?
Yes, ma'am.
So how did we diagnose it? You can come this way and look at this. It's a book. We don't have the book right now in our office, but we did check in on him the other day. It's called the Ishihara Color Vision Test, and this is a classic book that's used worldwide. So normally we can see the numbers, but he noticed how he will have difficulty. And you, who is making the video, you can also tell us if you can see it or not, so that we can compare the findings. So can you see that number there?
It's 12.
Okay. And also just to let everyone know, the audiences and you know, that the color vision comes from the retina. The retina has layers, and that's where the color vision comes from. So there's rods and there's cones. If people have color vision problems, they could have it because of they have genetic defects like the X-linked recessive disorder, where the woman is the carrier and the males have the problem. Or it could be optic nerve head defects, it could be macular problems, retinal complications, and even trauma related also. Okay. So this is 12, you said. What number is that?
21.
21? And what do you think it is?
74.
Perfect. It is 74. And it's not to make you feel bad, but this is the way we generally test color vision. Okay, let's move to the next one. And also one more thing to remember when you go to the doctor's office. Right now we're just making the video, but the lighting has to be different. It has to be like a white light. And if you need glasses, you can wear them also. What number is that?
6.
Good?
6, yeah.
Mm-hmm. That's a little difficult.
Yeah, I can't see anything right
16.
Good.
now.
2.
Good. So it's getting a little bit more difficult because you see the contrast sensitivity is also getting
That's
a little
like
bit difficult.
70 or 76.
29.
Good. So this is color vision problem. This is 7. That's a very difficult one. Can you tell?
No.
45.
Excellent. It is 45. But I'm trying to get to the one that this is a little bit relatively easier. And also we're going to go further, but again, just for the information and education purpose, you asked me, or I think your mom was asking me the question the other day, what is the treatment? Well, normally we don't have any treatment for this. People just live with it. It's not severe. Like, if you look at different colors, maybe this color, can you identify this color right now? It is blue. So he's not like totally color blind. There are certain shades of blues and greens that you're going to have difficulty differentiating with, right? So it's not like always it's going to be an issue. I'm trying to find a different color for him. This will be a good one. So what color is this? You can look at.
So like a forest green teal,
And this one?
purple.
See, so that's the problem. So if they are separated, then probably you will be able to identify, like you said, this is blue, but when blues and greens are together, it just looks a little bit different. But in reality, it is blue, and this one is green. Again, it is what it is, So to talk about a little discussion about the treatment. So he asked, and his mom asked me the same question. According to research, yes, there could be special glasses that are made which improves the contrast sensitivity for that. Now, do I have those? No, I don't, but that's something to look into also. If it's severe color vision problem, then yes, you can also look into that. And then some patients ask me, are there certain jobs or professions where they cannot, perform well because of their color vision problems? Those jobs, any ideas what those jobs could be?
I know one, it's a boat captain. You can't be captain
Okay.
of a boat.
Any options? Pilots, they can have difficulty. Doctors, especially if I'm doing surgeries and if I cannot differentiate the color, that becomes an issue,
kind of fun.
especially in the eyes. And those kind of professions, yeah. Okay. So you cannot see that one, right?
That's 2.
That was 5, okay. And that one? This is a very difficult one. Let's see who can get that one right.
I see
Any
orange
ideas?
in the left of it. That's all.
Okay.
97.
Good. I think that was a difficult one. That's 8. And that's, can you see that one?
Is that 12?
42.
Yeah. So how do we know if someone has failed the color vision test? Well, they have to get a certain number of things wrong among the 12. So this is the
Yeah,
last one now.
Most of them. Wrong.
Yeah. So that means that he has color vision problems. Now in the book, if you remember, on the last one there is a line, and you have to. I don't know if I did that one with you or not, but you have to trace the line from one end to the other and then trace it back. And
We
people
didn't
who
get that
have, we didn't get that far because I was like, oh no,
Yeah,
it's
yeah.
already,
You stopped at
it's
the third
already
page.
diagnosed. Yeah, I just stopped it at number 2 or 3, I guess. Okay, so that's about color vision problems or color vision deficiency. Any questions?
No, ma'am.
None? Okay, well, good to see you again. You have a good day. Thanks.